Hello, and welcome to ClearLine IV device training. I'm Allison, clinical specialist at ClearLine MD. This is a 5-minute tutorial on the setup and the use of ClearLine IV, the only FDA-cleared device that automatically detects, captures, and eliminates air as small as 25 microliters from your IV lines. When using the ClearLine IV, there are a few items that you will need: the device itself, a single-use sterile cartridge, fluid, your administration's extension set, and administration set, standard fluid box. When using the ClearLine IV, you may use it with pumps, warmers, or free-flow lines, as well as filters and syringes. ClearLine IV can handle a maximum flow rate of 600 milliliters per minute. ClearLine IV can be used with any fluid that is compatible with standard IV tubing. This includes blood products, and medications, including propofol and liquids. When setting up the device, place the device as proximal to the patient as possible, thereby ensuring any air entry would occur above the device and therefore be removed. When inserting the single-use sterile cartridge, there are two things you must keep in mind. First, after opening this cartridge package, check to make sure that the waste bag is securely fastened, as it may have loosened during shipping. Second, you want to remove the plastic clip on the bottom of the cartridge. This ensures there is an open fluid pathway to your patient. To install the cartridge, first, open the ClearLine IV device door by pushing down on the blue latch. When fitting the cartridge into the door, first insert the top of the cartridge with the holder tab aligned to the wide opening in the door. Next, firmly push the bottom center of the cartridge and you will hear it click when it's latched into position. Finally, shut the door with the installed cartridge and it will automatically lock. Next, connect your administration set to the inlet lure of the cartridge. Then, connect the extension set to the outlet lure of the cartridge. When all connections are tight and the door is latched, turn on the device and then turn the flow of fluid. After turning on the flow of fluid, the ClearLine IV device will now remove all air entering it and will effectively prime the IV circuit and the ClearLine IV cartridge. During this time, it will display AirGuard Active, removing air. Once the priming process is complete, the removing air message is no longer displayed, only AirGuard Active will be displayed. Please keep in mind that the device does not remove any air below itself, so it's mandatory to manually prime all lines below the device. ClearLine IV does not remove air below the device, so make sure your extension set is fully primed before connecting to your patient. Once again, while operating ClearLine IV, the device will indicate AirGuard Active. This means that the device is automatically and continuously searching for air. When air does enter the device, it will also display removing air. There is no audible alarm for this. It is simply doing its job. Every time an air mask is removed, you will see an air bubble on the screen along with the estimated volume of air removed from the device. There are safety checks in place that ensure ClearLine IV is functioning properly. If any of these safety checks come back negative, the device will alert you with an audible alarm and display a message. These alarm messages include: insert cartridge and close door. This alarm indicates that the door is not shut properly or the cartridge is not installed properly. Check the cartridge and make sure it's inserted into the door correctly. Make sure that the plastic tab on the cartridge is removed and that the latch on the door is fully locked into place. Once the door is shut correctly, the alarm will resolve itself. Unit tilted, position upright. This alarm signals that the device is not in an upright position. ClearLine IV must remain vertical to function correctly. This alarm will resolve itself once the device is set upright. At this point, you should check that your distal lines are free of any air. Continuous air. Check IV bag and lines. This alarm indicates that the device has been removing air for more than 60 seconds. Once the air has passed, the alarm will stop. We recommend checking to make sure that the IV bag is not empty and there are no occlusions in your IV line. Overtemp. Turn off no air removal. This alerts that the device is overheating. In this instance, you must discontinue use, turn off the device, and keep your setup as is. The infusion will continue, but you need to manually monitor for air entering your lines. Call ClearLine MD Technical Services and we will then send a replacement device. Failure. Turn off no air removal. This is an internal error. In this case, do not use this device. If this occurs while you're in use with the patient, discontinue the device by simply turning the device off and keep your setup as is. The infusion will continue, but you have to visually monitor for air in your IV lines as the device is no longer functioning. If the failure alarm displays, call ClearLine MD Technical Services and we will replace the device. The ClearLine IV battery life lasts up to 5 hours as it is displayed on the LCD screen. Green means you have 5 hours left, yellow, you have about 2 hours left, and orange, you have about 15 minutes. An alarm will sound and you will see the message, battery low, plug into AC. Like I said, this means that there is 15 minutes of operating time left and the device must be plugged in. After 15 minutes, if the device is still not plugged in, the battery can no longer sustain system functionality. The device will display battery, turn off, no air removal. At this time, turn off the device, leave your setup as is, and manually watch for air in your IV lines. Make sure to plug in the device as soon as possible.
There is a silence button on the top left-hand corner of the device. You can press this button to silence the alarms while you are troubleshooting.
There are a few key points to remember. While the device removes air entering it, it does not remove air below itself. You must prime the extension line before connecting to your patient. Failure to do so can lead to serious injury or death. ClearLine IV removes air as small as 25 microliters and has a maximum flow rate of 600 milliliters per minute. That concludes the ClearLine IV tutorial. Please complete training with the electronic user evaluation. Thank you for your time and enjoy using ClearLine IV.